Hi guys, welcome to New Age. Thanks for visiting our website. Rhinoplasty surgery is a procedure where we're altering the shape of the nose and sometimes the function of the nose as well. The way I do this procedure is I do something called an open tip rhinoplasty or a septorhinoplasty. That means there's one incision here between the nostrils, everything else is inside the nose. We basically lift up the skin, like opening the hood on a car, and then we're altering the cartilage and the bones inside the nose to change its shape. Surgery takes me around 2.5 hours. If we need to do any airway type of work as well, like for example, if someone has a deviated septum, that can add about another half hour onto the case. This procedure is one where we are not trying to dramatically change how someone looks. We're going for natural changes. If someone tells you that you look like you had a nose job, this is not a compliment. So what we want to do is we want to have someone's nose look more in balance with the other facial features in harmony. Once patients wake up, there's dissolving stitches in their nose, there's stitches in the skin that have to be removed, there's also a splint on the nose. The splint is there for about a week. It's just there to control swelling, and it's also to help the skin redrape and heal in a uniform fashion. I see people back at the clinic at 1 week, remove the splint, remove any other tapes or dressings that are there, and remove some of the skin sutures. When the splint comes off, people will notice often that the profile has a change that they're looking for, and sometimes it's a very emotional moment when people see, the change. But other things or other parts of the nose can take longer to see the final result. So a good example would be the tip. Right here, this can take a full year for all of the swelling to come down. This doesn't mean that someone's going to be walking around with a swollen nose for a year and people are going to point it out. What it means is if you're looking for a very subtle change in terms of millimeters, it can take you a year before you see, what you were looking for. If you're interested in learning more about this procedure or scheduling a consultation, please scroll down to the bottom of the page and I'd be happy to talk to you.